who are abused either by their relatives, but mostly when children are abused by relatives. It's an everyday experience. Not even a single day will pass without any case of a child being abused. We deal with those cases every day and every night. Yeah.
Okay. Ms. Gazangeni, let's talk about, we're talking about the mental toll it has on you. What exactly are we talking about here when we talk about the mental toll that social workers experience as they assist and help in these situations?
Thank you so much. You would recall that as social workers, we get all kinds of cases like Mr. Moyo has alluded to. These are coming from individuals, they're coming from children, and they're coming from the family as a unit, but they're also coming from a community. So you can also, from this diversity, you can tell that the magnitude and the depth, as well as feelings that are attached to these cases, would vary based on whether this is an individual, it's a unit, or it's a larger community. And as social workers, much as we are trained to empathize and to be able to be in the shoes of our clients, we are human beings. At the end of it all, you really wish, sometimes limited by the resources that you have, you really wish that you could do more in some cases. And the fact that you feel that you should have done more, or that if you were not, you know, following the ethics of the profession, you could, you know, go beyond the call of duty and do more. That in itself becomes a burden. You carry that with you at home. You carry that with you to your children, to your partner, to your family, such that you find yourself sometimes having to lash out or sit in a corner where you are trying to process these feelings. Or at times really trying to also process that, you find other coping mechanisms which might not necessarily be okay for profession or for a professional, such as a social worker.
Okay. I'm going to start with the point that you ended up with, and I'm coming to you, Mr. Moyo. You talk about finding coping mechanisms because of the diversity of what comes to you. What coping mechanisms are these? Mr. Moyo.
Those coping mechanisms, they may be positive, they may be negative. But sometimes you find that in most cases, they are negative. Maybe you are knocking off with that stress from the clients. When you arrive home, you also have those problems with your kids or your family. You end up maybe trying to abuse or abusing your family. The wife at this point are the ones who are at the receiving end. Sometimes even the children. You'll end up beating the children without even noticing that you are beating them. Trying to lash out, trying to vent out. Sometimes you even, maybe you are not a drinker, you even now start drinking heavily, which will now, going forward, it will impact in the family, because more money now will be used in drinking.
Okay. Yeah. And possibly impacting the job then that you do in protecting the victims or survivors. Yes. You earlier on you also mentioned the code of ethics that govern the profession. Let's just look at within the code of ethics. Anywhere else, is there a provision of then how do we support social workers? Who takes care of you guys as the people that take care of others?
We don't have that as a national policy or a national law, so to speak. However, in our training, we already have it as part of understanding how do you care for the carer? And one of those things is that when we get to our workplaces, we need to make it work based on our training. We do things like case conferencing, where you would have your colleagues and you sit down, you go through the case as was, and they help you think through the issues that you've discussed with your client, but they also help you to process your own feelings or emotions as well that are attached to that same case, such that you can then, from that discussion or the case conferencing, be able to cope better, and perhaps the subsequent sessions that you have with the same client, that you can handle them in a different way. We also do have one-on-one with our supervisors, and this is where you can also debrief, so to speak, in terms of just letting your supervisor know how you are feeling with certain cases, and this is where we now also draw strengths in terms of as a team would then know that this one is good in child welfare or child protection, this one is good in family reconciliation, this one is good in addressing cases that are related to stress, because of those debriefing sessions that we have with our supervisors. Beyond that, we then have the personal debriefs that we have. We have people really knowing what other coping mechanisms they can employ. Whether you're a bookworm, you can now do your novels or your movies, or like Mr. Simon said, some of them really wind through a glass of something.
Okay. You talk about debriefs. I'm curious to find out from both of you, is this a compulsory thing? Is this just something that's just encouraged that it happens? And if it doesn't, how do you pick that my colleague is going through something, therefore an intervention is required? I'll start with you, Mr. Moyo.
Yes. Debriefing is very compulsory. And you will notice that your colleague is going through some difficulties. You will find that your colleague may be someone who's jovial, happy at all times, but maybe for a month or a week you can see that this person has changed. By that you intervene by maybe trying to debrief with your colleague, or you refer your colleague to someone who will assist him or her better than you.
Okay. Yeah. Ms. Motimedi-Gazangeni, you are here from an association, you are representing your peers. Let's talk about some of the worst case scenarios where people have been impacted by the work that they do, and how that manifested itself in terms of the work that they do on a day-to-day.
Such impact, we see it mostly with casework or case management work, where it's individual cases, whether this case is about child adoption or protection or abuse. We would see firstly at work, it would mean that the same colleague would not facilitate the closure of the file with such a client, and then somebody else has to take over. Or as Simon said, we would see this person changing in terms of character, but we'll also see in terms of a colleague passing on some of these cases. We are allowed by the profession, it's one of our ethical conduct, that if you feel that you would not do justice to a certain case, then you can recuse yourself and refer the case to a colleague, so that you don't do damage to the client. So such instances would then tell you that it has impacted the same colleague, such that they can't now do a similar case or a case that is similar to one that really did affect them. We can also see when we are starting to abuse substances as a coping mechanism, whether these substances are alcoholic or everything that is done in excess becomes a problem, and we could tell. Other instances, of course, is the conduct where you knew this person to be punctual, to be, giving clients the rapport as we know it, but all of a sudden they've changed that, and in terms of how they interact with clients as well as colleagues has also changed.
How would you like then to see maybe the landscape within which you work, the framework within which you work, how would you like for it to change such that there is support, possibly mandated from a policy perspective, to ensure that there's support, psychosocial support, and everything else that goes with supporting you to be able to do your work as best as you can, Ramoy?
I think the policy should be there. This policy which will be forcing organizations, government, and every sector which is possible, every sector which is responsible for assisting children. This policy should not only be only written, it should be followed and done the way it is written. For now, we don't have that policy which is forcing all those organizations to look into this matter. All social workers at the forefront, they are stressed by this work. So really, the government should impose the policy, or should see to it that this policy is put into place and running, so that social workers can benefit a lot from it. Okay.
Now, in the absence of the policy, because we know there's a process for policy formulation, what are the immediate things that you would want to see happen, either from a government perspective, civil society, the private sector, to support you in the generous work that you do in building our communities?
Well, I think the first thing in terms of government is to ensure that the policies are there, as Simon said, but over and above that, we need the Social Workers Council as an act of parliament that can ensure that we do have a mediator who is mediating between clients getting the best service, but also ensuring that social workers adhere to ethical conduct, and that through that we can be effective and efficient as social workers, and that we can get the mental health support as a system that we need in order for us to optimally function in our duties. The other element in terms of the private sector, NGOs, and any other employer for that matter, would be to facilitate for us to meet with other social workers. Like I said, debriefing when you do it with a colleague, it really does make a difference. We have annual events. We have the Social Workers Day, which is coming up in March. It would be nice for social workers to just be together during that commemoration, so that we can get our mojo back, our energy back, and we can debrief through that process as well. Remember the different aspects of our profession through colleagues, and revive that spirit of giving more when you get back to the office. We also do have an annual general meeting, which also happens in a year. That's the opportunity for us as well to learn what have other people done, such that you can replicate it or pollinate in other areas. So those aspects can really help us. And beyond that, I think you're doing a good job as the media. We can partner with you and raise awareness so that we understand what social work is and what it isn't.
Okay. And I know we've been focused on the emotional and mental stress that comes with your work. But do you ever find yourselves in any physical danger of some sort when you go into these environments to assist?
Yes, it happens a lot. It happens a lot. Sometimes you find that, like during COVID-19, when you enter in the yard of the owner, there will be dogs. Some of the social workers have been bitten by dogs, those big dogs, even small dogs. Sometimes some of our community members are hostiles. They will not allow you to enter when there is somebody there you want to assist. Sometimes in the office, someone may come with a toban, a big stick. Some of our colleagues have been hit hard by the customers we serve.
Okay.
It happens a lot.
Just out of curiosity, do we then treat that as violence, or is there a special dispensation that says these people were on the line of duty, therefore this is how we handle these sort of issues?
It should be treated as in the line of duty, and that is why perhaps we have also been saying social work is a risky job, because we also do remove children from toxic environments where there's abuse, or even, you know, sometimes are forced to take, you know, spouses or partners apart because there is so much violence. And we're trying to mediate by removing one from the other, and that's where we experience that violence. So risk allowance would make a difference in such cases.
Okay, unfortunately we've run clean out of time, but 30 seconds each. What would you want the community, the government to understand about the job that you do in relation to the risks that you face?
The community should know that we play an important role. We are there to assist them. We are not there to gain or to earn money. Most social workers, we volunteer. Even though we are being paid, we are not paid like other professionals. We are rendering as this is voluntarism for us. So they should understand that.
Okay.
From my end, let every person utilize social workers. We are found everywhere, everywhere where they go on the counsel in hospitals and in clinics. So for every issue that people are experiencing, please do utilize social workers.
Okay, thank you so much. We were speaking to two representatives from the Botswana Social Workers Association, Simon Moyo, le me Felistus Motimedi-Gazangeni, speaking to us about some of the issues that they come across as they do their work to assist children, men and women, to ensure that they bring safety to them, to build our communities. I take it that wherever it is that you are, when they do come to you, you will ensure that their safety is top priority.
Bagaitso, hurt people will hurt other people. So let's break the cycle of violence. Seek help, even if